Namaste, Doctor.
Namaste, Andy.
Thank you. Thanks for coming to my show, Point to Point with Shiv Vadlamudi. I read a little bit about you. It was very interesting, very fascinating. So, how did you, let's start with this.
Sure.
Very interesting. How did you manage to become a cardiologist, yet a mom, a daughter, a wife, and above all these things, an entrepreneur? As if this is not enough, you're also a real estate agent.
Yes.
What is your idea? Do you want to kill people or what? So if you're doing everything, how do you manage that?
Yeah, sir, it's tough, but it's manageable. Sometimes I feel like 24 hours in a day are not enough. I need more hours. But I have a lot of support from my family. My husband is supportive, very supportive of my career. And my parents are my biggest strength. I think because of these, I'm able to pull through. And I've also always been ambitious, an ambitious person since my childhood. And, sometimes when something comes up and I want to do more about it, and I have all the support in my family, so I'm able to pursue it.
So it's still very, very interesting. Cardiology itself, so help us understand what kind of cardiologist are you,
I'm a non-invasive cardiologist,
okay.
where we do all the diagnostic part of cardiology, the stress test, echocardiogram, and ultrasounds like vascular ultrasounds throughout the body. We come up with the diagnosis, and if the patient needs an angiogram, that's when we send them to the interventional cardiologist, or if they need a pacemaker, we send them to the electrophysiologist. So basically, that is what is non-invasive cardiologist. We do not do any stents or pacemakers, but we refer them out when needed.
Wonderful. So this is actually creating more curiosity for me to understand your little background. Let's go back a little bit and help understand my viewers as to where are you coming from and what actually drove. Obviously you're from India, and, your local place and all that stuff. Help us understand. Let's walk through that journey up until how did you land in America?
I come from a family of physicians. My dad is a physician. He's an internal medicine doctor in India. We owned a multi-specialty hospital at one point. My dad's motive was to educate us. That's the reason we moved in 1990 to Hyderabad. We actually hail from East Godavari district, where my mom is from Kottapalli. It's in Gokavaram Mandalam. And my dad is from Goneda. It's near Jagampeta. So, but my dad was a physician. He joined med school in 1973. And he was MCAT third at that point. We just had MCAT. Yeah. So I come from, very ambitious family. And so he didn't even know, actually, at that point, he didn't even know that he came third. He just wrote the exam and he went back to his village. And in a paper, I think he was with some tutorial, at that point, like Kakatiya Academy, something like that. At that point, only for 3 days or something. And then he came back home, but he studied on his own. They published in the paper saying that he got third, advertising their academy. So that's how he got to know that he came third.
Okay.
And but prior to that, our ancestors are all farmers. They're into farming. So my dad is the one who came out and started education. So he wanted to raise us, we were just two girls, me and my sister. He wanted to raise us like boys, So he was our biggest strength. So we came to Hyderabad. Me and my sister graduated from Nasser School. That's where we went to our schooling, high school. Hyderabad is a very prestigious school. And then we went to Kakatiya Academy for 2 years.
Did you say Nasser?
Nasser.
Nasser, okay.
Where Dia Mirza and Sania Mirza, they graduated from. We're from the same school.
I see.
Yes.
Okay.
From there, we went to Kakatiya Academy for 2 years. And of course, wrote MCAT and got in the first go. So initially, I was very good at mathematics.
Okay.
And
so
I wanted to
if you don't mind, what was your rank in MCAT?
My rank was 1000.
Oh, okay. No, that's not bad.
It's not bad, especially in the first go,
Yeah. And
so
compared to your dad, third to 1000 is a different story. I
cannot compare my dad with me. We cannot. So we went into med school. So my inspiration, initially I wanted to be an engineer actually, because I was very good at maths. Till the last minute I was thinking that I was going into MPC. Then I sat down that day and I asked my dad, what do you suggest? He never forced anything on us. And then he said, if it is medicine, I can guide you for the rest of your life. If it's engineering, I can guide you only to a certain extent, you know.
Right. You're on your own.
Yes. So, and then I sat down with my sister and I'm like, okay, so what, she was already doing her intermediate. So she was doing her biology already, like botany and zoology, because she's 1 year older to me. And then she said, you know, you're going to deal with like, you know, a living cell, you know, and how precious is that, you know? I think that one sentence, and of course she talked to me for a long time, but that one sentence actually changed my mind. And I steered my gaze and I said, okay, I'm going to buy PC. So I don't have any fancy
Living
stories.
cell.
Living cell, exactly.
Is your
So
story. Okay.
she said it's very precious. You know, you're going to deal with a living cell and you're going to save it. You know, so that's actually changed my mind. And then I went into BIPC. I don't have any fancy stories. It's just, you know, my family, what guided me this way. But whatever field I did, I always wanted to be in the top. Good, you know, that was always my ambition. So then I did my medical school in Mamta Medical College, Khammam. I graduated in 2007. And 2008, I came to United States. My sister was already here at that point. And we did research. I did research in MD Anderson Cancer Center, Houston.
Oh, okay.
It's one of the top cancer center. Actually, that one and Dana-Farber, they actually compete with each other in the, you know, cancer. Cancer, I mean, oncology-related hospitals in the world, actually. So I did research under Dr. Yusuf, cardio-oncology for about 9 months before I joined my residency. I got my residency spot, but I actually didn't go back. I stayed back because I was so interested in cardiology. And I did research. And I had a lot of publications from there, you know. And that's when my interest of cardiology actually got even more. Prior to that, my interest in cardiology began with my dad teaching me EKGs on the dining table every day. So after we finished our dinner, we used to sit down and we used to just go over EKGs. And I think that's where my interest began. So even my friends used to tease me in my, you know, in my 4th year of medical school, when there was a cardiology case, they used to grab me and they used to say, hey, this is your case. You want to present this? Because the cardiology attendings were, you know, they're very strict and they screw you with a lot of questions. So they were like, they used to push me for every case. Gotcha. Because I was already interested in cardiology. Even my colleagues knew it even before I knew it, frankly speaking. So, and then I came here, I think when I did research, that's fueled my, you know, interest even more. And then I went to do my residency at St. Vincent Hospital, Worcester, Massachusetts. For 3 years. It was a great program. And in one of the interviews, you know, Dr. Pratap Reddy Garu, you know, the founder of Apollo Hospitals, he actually graduated from the same hospital, but in 1972. I graduated in 2012, so 50 years apart, but we graduated from the same hospital. College, I felt really good when I heard that interview. That's good. And then from there, I went to Christiana Care Health Sciences. That's in Delaware. It's an affiliate of Thomas Jefferson University, where I did my fellowship in cardiology. And then I moved to New Mexico. My sister was a hospitalist there, and both of us worked in the same hospital I worked for 6.5 years. And then we were deciding where to come back, like me and my husband. And we felt Dallas is our place because we have family, friends here, a lot of Indian community, and we always wanted to serve Indian community. So that's how we ended up coming to Dallas. And I've been working at JPS, John Peter Smith Hospital. It's a county hospital in Fort Worth, 2 years now. And I'm the director of Department of Echocardiography there. I have 36 echo technicians under me and a couple of administrators. I would say I deal with 45 people. Almost every day.
Besides your patients?
Besides my patients. That's the admin work. That's an administrative work. And I did hold a lot of leadership positions in my previous job as well in New Mexico. Gotcha. I was the director of cardiopulmonary department. It was a small hospital, but it had a catchment area of 200,000 population. I was a single cardiologist. There was another private cardiologist who was part-time. So I was the single full-time cardiologist in that small town. It was very rewarding. Because patients
have to. That you said?
It's called Clovis, New Mexico. It's like 3 hours east of Albuquerque. Yeah, but it was very rewarding because for the patients to go and see a cardiologist, it was a 2 hours drive. You know, you would not imagine that there are places like this exist in the United States, but there are. It's rural New Mexico. Gotcha. But they were very grateful, you know, when I served there for 6.5 years. They were very sad when I was leaving, but we had to like, you know, come back to here. You know, because we wanted to serve the Indian community and all that.
Gotcha.
And then we opened our clinic recently
Mm-hmm.
here in Frisco. It's called Daffodil Primary Care and Cardiorenal Clinic. My husband is a primary care physician and also a kidney specialist. And because the kidney problems are very closely associated with the cardiovascular, and
Mhm.
anything cardiovascular related or the heart related can affect the kidneys. So I think it was a great combination of what what we came up with. I mean, he was naturally interested in nephrology. He didn't do it just because I did it. He was naturally interested in that.
You
and
didn't
then we
marry because that would be the case, right?
Absolutely not. Because
Okay.
when we got married, he was not even in his fellowship.
Oh, yeah.
You know, he was
I'm
a
just
chief
kidding, yeah.
hospitalist for like 8 years.
Oh, okay. Good.
But yeah, but it just worked out well. And
So destiny.
yes,
Destiny,
and we are
good.
here in Frisco as well.
Good.
He primarily runs that clinic, and I am like part-time there.
Okay. Okay.
So-
Good. Good. So he pays you. I'm just kidding.
He better pay me, right?
Good,
if I ask him that, he says everything mine is yours.
Oh, yeah.
My mom is like,
Standard.
don't believe that.
Standard dialogue, right?
Standard dialogue. I know.
Indian dialogue. Okay. Anyway, I didn't want to stop your flow,
Yeah,
but I have several questions
Go
around
ahead, sir.
your journey also. Essentially, what I see today, the youngsters, right? Lot of youngsters are. I mean, I see the Indian kids, of course. They are pursuing the medicine school.
Sure.
Even before we go there.
Yeah.
So how was your transition? You came from India
Yes.
directly.
Yes.
And then you did your USMLE.
Yes.
And okay, so how was the transition? I mean, you are in a totally different
Yes.
land
Yes.
where there is everything different than
Right.
what you see in India,
Yes.
right? Other
Yes.
than just you probably spoke decent English because
Yes.
you are from Hyderabad.
Yes.
How was that? Well, how was the transition there?
It wasn't that bad, Andy. But initially there were some hiccups for the 6 to 8 months, primarily because we were so dependent on our dad. You know, we didn't even know how to write checks and
Oh.
things like that because he took
Okay.
care of everything for us. I think
Okay.
that was an adjustment period for us for 6 to 8 months. But other than that, we didn't feel anything that different. But you're going to have some cultural differences when you come
Right.
from India to here. But it didn't feel that odd. But
Okay.
in fact, if you ask me, you're going to have some cultural differences. When I came from Northeast, from the New England area to New Mexico, there were differences too.
Ah, okay.
Because it's very fast paced in Northeast,
Uh-huh.
and they were very slow paced in New England area, and like New
Relaxed.
Mexico, they were very relaxed.
Okay.
In Northeast, they were very patients who were very involved in their care. When it
Okay.
comes to New Mexico, they never cared.
Oh,
So,
okay.
you know, the differences are going to be there, even the people. So the differences are always going to be there, even when you change from region to region.
Right.
So it wasn't that bad because
Okay.
we had cousins and family here.
Okay.
So I
So
think that makes
the
a huge
language
difference.
was never an issue then? I mean,
Language
you
was
understood
never
the
an-
patients well?
I actually rotated in Harvard too. One of the professors in Harvard told me, you speak excellent English,
Okay.
but you need to slow down a little bit when you talk.
Yeah. You are talking really fast now too.
I know
So
because
that's
it's,
like
with Telugu is very fast spoken language. So
Right,
you
right.
speak the same way.
right.
I tried a lot, but I couldn't slow down.
Well, it's working out for you though, right?
Well,
That's
most
good.
of my 95 of my patients are pretty good.
Okay.
5 of the patients, especially the older patients, tell me, "Can you slow down a little bit, Dr. Bathina?" And then I slow down for them. Yes.
Good. So, doctor, so like I was talking about the kids coming into and trying
Yes.
to do the USMLE
Yes.
and all that stuff,
Yeah.
right? I do see a lot of kids going through pretty decent amount of turmoil. Like
Yes.
so is that really that difficult? Is there a way they should be able to achieve that, or any suggestion for that to get to USMLE, get through the USMLE for the kids?
So the problem is in India, what we are taught or what our exams are all based on, Andy, it's like you have to write 2 or 3 pages for one question, and they give you like 5 questions, and you just keep writing about that one question. Coming to USMLE, it's multiple choice questions, okay, and then more clinical approach. So I think that's where we are lagging.
Okay.
So we don't have that kind of an approach in India. Our teaching is different, but the way the question is here, it's different. But if you can adapt yourself from the first, if you know that you want to come here, if you can adapt yourself from the second year when you start your clinicals itself, you can adapt doing more multiple choice questions. I think that's going to be helpful. That's what I would say.
Okay. So this is for the kids who wants to come from India to
Here, yes.
Right? That's the USMLE
Yes.
part. what about the MCAT? The kids who are here, who are raised here,
Yes.
they want to do the MCAT. Any suggestions for them?
Actually don't know much about the system here.
Oh, okay.
But they have to do a lot of rotations for sure.
Okay.
And our clinic do offer like rotations for medical students or students who are interested in going into medicine. They are more than welcome to rotate with us.
Oh, okay,
Yeah.
okay. So,
So
that's a very good information.
Yes.
So, would you please tell us our viewers that how do they reach out to you if they have to go through that?
They can reach out our office. They can reach out our office number. It's Daffodil Primary Care and Cardiorenal Clinic. If you Google it, you'll get it. So you'll have exposure to primary care and kidney specialty and cardiology.
Can you repeat the name
as well.
of the clinic, please?
It's Daffodil Primary Care and Cardiorenal Clinic in Frisco. It's on 4300 Punjab Way.
Oh, okay. Very good. That's easy to remember.
That's very easy to remember.
Okay, 4300 Punjab Way is where your clinic is.
Yes.
That's where your husband is physician.
Yes.
So kids can reach out to you if
Absolutely.
they have to do the rotation.
Absolutely. We already have some kids already rotating with us.
Oh, okay. That's really good information.
Yes.
Okay, wonderful. Very good. So passing through the USMLE and all that stuff, right? So let's get into more of your day-to-day job, right?
Yes.
And of course, I am sorry I didn't ask about your kids. How old are they?
I have two kids. Okay. I have a 4.5-year-old boy. His name is Tridev, and my daughter is 2.5 years old. Her name is Shilpa Bathina. So my daughter gets my last name, and my son gets my husband's last name.
Oh wow, that's interesting. So you shared the last names?
Yes, absolutely. Why not?
Oh, wow. And what made you do that?
I mean, my daughter's name goes after my sister's name, whom I lost 6 years ago.
Oh, I'm so sorry, doctor.
But I always, even before that, I always wanted to name one child after my last name. Why always the husband's last name?
This is something new. I haven't personally heard anybody doing this. And this is really, really new. I think a lot of our Indian brothers and sisters should hear this out, and somebody wants to get motivated, well and good. And
actually, even Americans, not even Indians, they're surprised to hear that.
You bet. In America, I mean, you can do, you know how it works here, right? But then in Indian culture, it is a little different, right? Above all these things, I should appreciate your husband.
Yes, that's what I was about to say.
He was supportive of that.
Oh,
right?
yeah, he's a very progressive,
that's
progressive
really
individual, actually.
That's very good. That's very, very interesting.
Yeah, so towards the end, maybe a couple of days left to deliver my daughter. And so I just told him that I'm going to name our daughter with my sister's name, and he didn't say anything. He said, yeah, that's fine, that's great. And then I asked him, are you sure? Because I didn't give you a chance to name your daughter, and it's going to be, it's going to be our last name. He said, if I say yes once, that means it's yes. And it's not about the name. It's actually, we're actually, what do you say? We are actually honoring your sister. Okay.
Right,
so she's a legend. We're honoring your sister. So
that's good.
That should be it.
Fantastic.
Yes.
I have to see him again.
You will love him.
Yeah, thank you. So anyway, so going back to your practice,
yes.
Let's start there. Thank you for your background. And I assume the kids will also become a doctor?
I don't know. It's up to them, sir. Whatever they want to do. There's no force. My dad never forced me, so it's up to them.
This is how it happens. I mean, in at least doctors' families, what I've seen, you guys will never force, but the environment you guys create, it will slowly guide them to that.
And maybe if it was in India, yes. But in America, they're exposed to so many different other subjects. And professions. So I don't know, whatever they want to do, I'll be happy.
Yeah, and maybe they will hate because of the busyness you guys are. Is that?
Not really. Actually, my son already chose a room in the clinic, saying that this is where I want to sit when I grow big.
Okay, there
and
you go.
He's like, I want to be a doctor like mommy.
Oh, there you go.
And my daughter also is like, oh, I want to be a doctor. I want to see patients. She asked me when I go to clinic, Mommy, can I come with you? I said, no, I'm going to clinic. She's like, oh, I can see patients. I'll help you see patients. She's 2.5 years old.
Wow. So I can see them becoming a doctor.
And very interestingly, whenever I say I have to go see patients, I have to help them, they'll be like, no, don't go to work, mommy, today. They'll say that. But when I say I have patients waiting there, I have to see patients. I'm like, okay. They're very understanding.
Good.
Yeah, very interesting.
So they got it.
They got it. Yes.
They got it.
They got it.
That's evident, looks like. So, yeah, before we get into your medical profession and
Yes.
your day-to-day life in
Yes.
medicine, I would also like to understand, why did you get into this real estate business? That is, um, I don't know if I can say it's heartbreaking for me, because a doctor coming into a real estate business, poor real estate guys,
No.
what will they do, doctor? Smart people like you get into that, I'm thinking you're killing them.
No, sir. Not like that. I don't have it's not a big real estate company or something. I'm not doing it for full time. So, to me and my husband, medicine is not to make money. So medicine is to serve, serve the sick. So we are not looking for money in medicine. We want to make money somewhere else if we want to. So that's where the real estate comes into picture.
Okay.
And then I worked with a lot of real estate agents, and no offense, some of them whom I worked with, maybe I didn't get the best real estate agents whom I worked with. They were looking at their interests, but not exactly what we were looking for. So that's when I was like, okay, let me do a little bit more research in it. I bought some books and I read them, and I read the books. So why don't you take an exam? So I took the exam and I passed. So
you bet you will pass.
so it wasn't. It was much easier than USMLE for sure.
Oh yeah, there's no comparison, right?
So that's how it started. But we're a group of friends. We all invest together. When a good property comes up, we're like, hey, you guys want to join? So all of us join and we invest together. We're helping ourselves and we're helping our friends as well.
So it's just that you're buying, or you're buying and selling? You're doing both?
We are buying. We sold our first property this year.
Oh, okay.
It was pretty lucrative.
Okay.
So we buy and we sell as well.
Oh, that's good. That's good. So in a span of what, like 10
6
years?
years.
6 years?
This is 6 years.
Okay,
yes.
Good. Okay.
This particular land is 6 years. Yeah.
Okay. Wonderful. Very good. Feel to continue the real estate
Yes.
for the rest of your life.
Yes.
Okay, good.
Yes.
So yeah, I also heard that you recently did help a student who
Yes.
has come from India, and then the day she landed here,
Yes.
she had an issue. Can you help us understand what that issue was? And
Yes. So actually, she had fever.
So that's basically, I'm sorry, tying back to your service motto,
Yes.
becoming a doctor
Yes.
is basically to serve the people.
Yes.
And I'm trying to tie that back to that,
Absolutely.
because I've heard about that also. So can you explain us?
Absolutely. So she came from India. I think she had a little bit of fever when she came from India on the day of her travel itself, but they thought probably it's just anxiety going to a different country and things like that. And she comes here, she becomes extremely sick. She goes to the emergency, she goes to the urgent care, and she ends up coming to Medical City Las Colinas, near my house, to the hospital. And because her parents and family is back in India, there was nobody who could get the information. And it's pretty strict here. We have HIPAA and all that. You cannot give information to whoever you want to hear, like in India. So it has to be only to the person related to you, or where
Correct.
You have a healthcare proxy determined in paper, not just verbally saying. And then she got admitted, and she was on a ventilator.
Oh, wow.
And they actually didn't know what was going on with her. Because nobody would give any information, and her mom in India was very, she was in tears, and
Oh, you bet.
yes. And then at that point, Priya from Apta leadership, she contacted me because she knows I'm in Irving, and she contacted me and she asked me, "Hey, could you just help us with this? We don't know what's going on. They're not giving us any information at all." Then luckily I had a friend who was working there, so I contacted her, and I was able to get more information. I was able to speak to the infectious diseases doctor there as well. She had a very bad case of typhoid, apparently, because she delayed the treatment as well, and that's the reason it got really, she got really sick. She was on ventilator. She was on medications to bring her blood pressure up. She came with typhoid here. Yeah, typhoid was very prevalent there. And the infectious diseases doctor was very nice. He spoke to me and he said, "I don't treat typhoid that often, but this is what I'm doing. And if you have more input, please let me know." I said, "No, you're doing fantastic. I think she's going to pull through this." And also they were not ready to give a letter for her mom to come to America. They were like, "Oh, we never gave such letters. We give letters only if the patient is dying." I'm like, her daughter is intubated on a ventilator.
Yeah.
And after she gets extubated, it's going to be, it's not going to be that easy. She's not going to walk from the hospital because she'll be very weak. She will definitely need mom's help, no matter how many people are around, mom is different.
Oh, you bet.
So
a mom understands mom better.
Absolutely. And then they have the comfort to ask the mom whatever they want to, rather than with anyone else, And all people who were there were just friends in their 20s. But there were two other people. One is family member, and other one is somebody like me. His name is Swaroop. He was very, very closely involved, and he kept me. And then I went and met her. I went and saw her when she had the tube on.
Oh, okay.
So I literally used to go almost every day to check on her status and
with
talk to the nurse.
With your busy schedule,
after my clinic, I should just go in my scrubs. So directly there, because I wanted to see her, how she was doing, So every day I used to go and check on her and talk to the nurse and see what they're doing, just making sure, that they're doing the right thing and everything is progressing well. Finally, she got extubated and she was just discharged a couple of days ago.
Oh, okay. This is very strange, doctor. I mean, situations like that.
Yes.
God sent you as a God-sent person. But what if there is nobody for her? What would happen? I mean, isn't that like, should you not go outside the books and try to do something? I'm just trying to understand how the system works here, situations like this.
See, the patient is fighting, and there's nothing I did here. Okay, the patient fought, and the doctors treated. I was just a middleman here, just trying to convey information from one to another. Even if I was not there, she would have still made it. She would have still come out well. But me being there was just comfort for the family.
Right, that's a big thing, right? The emotional aspect of it actually makes the patient recover faster, right?
Yes.
We all understand that.
Yes.
I'm not
she was very happy when she saw me, and after she got discharged, I didn't get time to see her when she was discharged, but even she was telling her friends that I have to go and meet her. I'm very grateful to her and things like that. I think it's the comfort I gave to their parents. I spoke to her mom as well in India.
Good,
it's the comfort I gave more than anything else. But unfortunately, that emotional connect is not there in America because of the HIPAA violations. Because you cannot convey information to everybody.
That's true.
That is a problem. That is sad, but it's a truth though.
It must be there for some reason, but then situations like this, there should be a way to figure this out.
But when I spoke to them, they did give me all the information. I told them I am,
because you're a doctor.
Yes, I'm, I'm a distant relative to them. That's what I told, and I got the information, and I was able to get. And they were nice. They were very nice. But
that's all because you're a doctor.
Yes,
Let's
absolutely,
be honest,
absolutely.
Right?
Otherwise, they wouldn't.
Somebody like us, if they call, then they would say, "Good luck, boy." Right?
Yeah, no, they wouldn't. They wouldn't. They're not supposed to. Also, they're not supposed to. Also,
Good. Anyway, so I forgot a vital point about you.
Sure.
I also know that you're a dancer.
Yes, sir. Classical dancer.
Yeah, can you please elaborate on the dancing part? I'm like all rolled into one kind of person, right?
Yes.
Now, dancing, where did that come from, and what happened to the dancing part? Is it still happening?
So we are Bharatanatyam dancers, me and my sister. I would actually call it Andhra rather than Bharatanatyam. And we learned it from 4th grade until I think the 10th grade. So for solid 6 to 8 years, actually, we learned it. And then we gave a lot of, every year we used to give programs programs in Ravindra Bharati, Hyderabad.
Okay. Hyderabad.
Yeah, I will try to retrieve some videos for you. They're in the cassette form. I have to get them transferred to the CD, and I'll be able to get some for you.
Sure.
And we were very close to do our Arangetram.
Oh, okay.
Yeah, Arangetram is
the final event ceremony,
where you give like 14 programs back to back.
Right.
Items back to back. And
that's like for 3 hours, 4 hours.
Continuously.
Right?
So we wanted to alternate, me and my sister, and then do it. And
so you dance for like 3 hours.
Yes, 3 to 4 hours in a row.
With 14 programs, and that's when you get
you're graduated.
Graduated as a Bharatanatyam dancer.
Yes.
This is okay.
Yes.
Wonderful.
So we wanted to do it, but that's when we finished our 10th grade, and my dad wanted us to focus on studies, so we went that way. But even in med school, we gave programs. At the end of our med school, we gave a program in 2007. That's the last time, though. I would like to give it. hopefully with my daughter in future.
Oh,
You
okay.
know,
So
and
you're gonna
probably we
teach
both will do Arangetram together at some point.
Yay. That's awesome, awesome,
she's
fantastic.
a good she's a good dancer already,
Okay.
and she has it in her. You know, she's like she doesn't look like my sister, but her personality is like my sister.
Okay,
Like,
so basically, you think you gave birth to your sister,
maybe I don't know.
right?
You know, I believe in reincarnation.
Yeah,
I don't know.
that's
Maybe.
a possibility. And then you are seeing your sister in her.
Yes, we all see our sister in her, and we named her. You know, my parents used to call Sweetie at home, and she's also called Sweetie at home. All my relatives call her the same. So
Okay,
I'm sure
that is so nice. That's an emotional aspect of your
it is.
life.
It is.
Besides being so busy with all the things,
Yes.
right? Extremely.
Yes.
I'm still, baffled with the amount of activities you have in your life. That is still not clear to me. I don't think we can get that clarity in 45 to 1 hour interview here. But anyway, so let's go to now the core part of your life, ma'am.
Yeah.
The medicine, right?
Yes, sir.
So you're a cardiologist.
Yes.
You do see patients day in, day out.
Yes.
What kind of patients do come to you? At what stage do they come?
It depends on where you practice also, sir. Because the economics of the patient changes. For example, where I practice right now is John Peter Smith Hospital in Fort Worth. It's a county hospital, so it's like a government hospital in India, where the patients do not come to your attention unless they have serious problems. So every other patient I see there are extremely sick. Literally, 1 foot is going to be in the grave and 1 foot at JPS hospital. So they're extremely sick patients. When they have multi-vessel disease, they have blockages in all the vessels or more than 3 vessels. That's how they come to us. Or where the pumping of the heart is pretty weak, the pumping of the heart is 15-20%. Opposed to Frisco, they're more educated population, more younger population. They seek attention earlier than later. Even if you have risk factors, they come in early, which is really good.
So if I may interrupt.
Yeah.
How would a patient know that this is a cardiac related problem I'm facing, or hey, I'm going to get a heart attack? How would somebody know? What are the preliminary things that he or she should be watching for?
So a heart attack presents this way. It's chest pain, substernal, pressure kind of sensation, as though somebody is sitting on your chest, like an elephant sitting on your chest, radiating to your jaw or radiating to your left arm. That's a classic presentation associated with shortness of breath. Sometimes radiating to the back as well.
So is it like any one of these or all together?
It can be any one of them. Okay. Sometimes you can just have jaw pain. I had a 95-year-old who just had jaw pain, nothing else, no other symptom, but you saw that she had a heart attack. So women present atypically and diabetic patients present atypically, they might not have chest pains. They can just present with shortness of breath or heartburn kind of symptoms, or like just left arm pain here and on the left side, or they can just shoulder pain.
So all you're talking about is on the left side you're talking about?
Yes, left side. Sometimes you can have right side pain also.
Okay.
Unusual though, but it can happen. Sometimes shortness of breath can be the only presentation. Sometimes back pain can be the only presentation. So they're called atypical presentation. But the classic presentation is going to be like the pressure kind of sensation in the center of the chest. Especially women and diabetic patients, they have to be careful because they'll have atypical symptoms, like just heartburn, just back pain, things like that. So you have to be careful and you have to seek attention sooner than later because it's shown in the data that women actually do not seek attention earlier than men, and they have higher mortality rate. Then you actually have a heart problem.
Why would women not seek the treatment earlier?
One, it's atypical presentation. Second, they concentrate on their family's health more than their health. These are the two things.
Okay.
Yeah.
I do hear a lot of young kids dying these days of heart attack.
Yes.
Right? They didn't even realize that it's a heart attack and somebody is gone. In my company, I've heard, he was, I think, 45, not even 45. He just passed out on the desk.
Yes.
Gone case.
Yes.
So what is causing all that, doctor? What is causing all that? What is your message to youngsters, whether it is Indian, American, whoever it is? What is your message? How should they take care of their health and heart?
So I hear this quite often, but frankly speaking, Indians have the most cardiovascular problems. We have heart diseases 3 to 4 times more than Caucasians here. Okay, and also when you compare the urban population and the rural population in India, urban population has more cardiovascular problems compared to the rural population. So that tells you that it's the diet, processed food in the urban population, rather than with the rural population. And the rural population also, they're skinnier. Their BMI, body mass index, is 20 compared to the urban population in India, which is 24 to 25. So when you look at the numbers, yeah, you'll be wondering, oh, the deaths are more we are hearing this more in America, not as much in India. Frankly speaking, if you look at the numbers, in urban India, the overall deaths from cardiovascular problems is 25% of all the deaths.
Oh, wow.
And in 25.6. In America, it's 27. So it's pretty close. Exactly, pretty close. So that tells us it's not that the numbers are higher in America. It's the same in India too. It's just you don't hear much, And the second thing is one is the food, definitely the processed food, what you find in the rural and urban I'm talking about, because that's all because of the processed food what we eat, and a lot of saturated fats we eat. That is not good.
So doctor, if I may interrupt,
the
processed food.
Yes.
Now I cannot grow food or vegetables in my backyard.
Yes, absolutely not.
Right, I will have to depend on those things.
Okay.
Because of the lifestyle. And not as much as you ambitious, but there are people who are ambitious.
Yes.
They don't have time for cooking.
Absolutely.
They don't take that as number one priority.
Yes.
So they depend on this processed food. They eat those food.
Yes.
How do they?
You can always make healthier choices.
Okay.
You can always make healthier choices. What I would do is I would try to keep the saturated fats to less than 6% a day. Saturated fats are butter, cheese, and palm oil. Actually, I would avoid that and try to replace them, and even the oil in red meat. I would try to replace that with unsaturated fats like olive oil and avocado oil, things like that.
Okay.
That is one. And have lots of vegetables and fruits in the diet. Actually, one study shows that Indians eat the least amount of vegetables and fruits.
Yeah.
And whole grains.
We eat a lot of biryani.
Yeah, when we look at some labs, me and my husband came up with this term called biryani labs. High triglycerides, high cholesterol, low HDL, they're all biryani labs. So, and they eat more of fish, lean meat, and I try to avoid red meat. So if you can make healthier choices, even the food you eat outside, I think that'll be enough.
That will at least compensate.
Definitely. That will definitely
eating straight off there. What about the exercises and all? Do you think that's anything?
Oh, yeah, absolutely. So there are a couple of things, sir. One is diet is very important. Second is to keep a BMI, that's body mass index, to less than 25. And actually, if they say for Asians, it has to be less than 24,
Okay.
But less than 25 is good. I'll be happy with that. Most of us are either overweight or like obese, and get your risk factors under control. The most important risk factors are diabetes, hypertension, and high cholesterol. You have to keep them under control. That means systolic blood pressure. The blood pressure has to be less than 130 by 80. For cholesterol, you have what is called an ASCVD score. You just have to take your cholesterol numbers and go to your cardiologist or your primary care physician, and they can jot those numbers down and tell you whether you need medications or not, or just lifestyle modifications. And diabetes, you should have your hemoglobin A1C at least less than 6.5. And if you're a pre-diabetic, you have to be aggressive in losing weight. And no tobacco, absolutely no tobacco in any form, like smoking, chewing, e-cigarettes, nothing in any form is bad. And keep your alcohol under moderation. And biggest thing is exercise. You have to exercise at least 150 minutes a week, moderate intensity exercise, or 75 minutes of high intensity exercise. Moderate intensity exercise is like brisk walking. That is 150 minutes is like 30 minutes a day, 5 times a week. That should be good enough. Or high intensity exercises are like running on the treadmill, you're doing your elliptical, they're all like skipping. All these are high intensity exercises, at least 75 minutes in a week. So if you could do that, I think these and the diet we already spoke about, more of nuts, vegetables, fruits. That should be half of your plate should look colorful with this stuff. So I think if you do all these things, that'll help you prevent. And I have to tell you something else too. When they looked at the numbers where the patients came from India, like the Asian Indians who actually live in America, And oh, I forgot to mention about the chronic stressor. We have a lot of chronic stress due to several reasons in this country, especially Asian Indians, right? Immigration, it might be immigration process. The entire process is stressful. The work we do here, and also we are nuclear families. We don't have a lot of support, family and friends. All these things lead to chronic stress. And the chronic stress also has a negative impact on cardiovascular problems.
Okay.
So you have to do some meditation, yoga, mindfulness. You have to incorporate that in your life every day, at least for 15 minutes. I'm not asking you to do like 2-3 hours of meditation,
correct.
At least 15 minutes. That gives you a lot of relief from the stress, because stress can negatively impact your cardiovascular health.
Somebody has to pick yoga versus exercise. Which one would you have them do?
You will have to do both, sir, because yoga is more for stretching and relaxation compared to exercise, because the exercises are like, you have to do high intensity or moderate intensity exercise where your heart rate should go up.
Okay.
They are aerobic exercises, so you need that. That's what we make you do when we make you walk you on a treadmill, right? We just make your heart rate go up. That's what we see.
Right.
So, but you need to have both of them. So you need to have stretching exercises in your life at least 2 times a week, like toning exercises, and you should do aerobic as well.
Oh, okay.
So
both you're suggesting that
I'm suggesting
have to do both.
Yes, you have to do both. I mean, half an hour in a day contributing for your health. I mean, you need to do that.
Right.
That is your responsibility, minimal responsibility, at least, because there are some modifiable risk factors which I talked to you about, but there are some non-modifiable risk factors as well. Like for instance, other countries where the prevalence of cardiovascular problems is higher, and they're high-risk individuals, when they come to United States, their risk actually becomes average. But for Indians, whether you are in India or you come to America, the risk remains the same. So that tells you that there is some genetic predisposition to it also.
Okay.
So that is something we cannot change. It's a non-modifiable risk factor, which you cannot change now. 100 years from now, I'm sure we can change genetics as well, right? But at this point, we cannot change the genes. So there are some non-modifiable risk factors like genetics. We are predisposed to more cardiovascular problems. We have smaller heart vessels compared to the other people, compared to the other ethnicities like Caucasians. And also we have other inflammatory factors in our body more compared to others, like we have Lp(a). That's a part of a cholesterol molecule, which is higher in Indians. And also we have more inflammation in our body compared to others, like high C-reactive protein, especially women, and also homocysteine levels. These all tell you that we have some genetic predisposition, which is actually contributing to cardiovascular problems. That one we cannot change, but we can definitely change the modifiable risk factors. That's in our hands.
So what about eating like, sweets and all that stuff, like sugars? That's a
moderation.
That's a moderation.
Maybe 1 sweet a week.
Okay.
Which I don't do it either.
So to everybody you're suggesting that, or to people who are, you think, more prone to the cardio issues?
Everybody should do it in moderation.
Okay.
Anybody above the age of 40 and have at least one risk factors, I want them to be very careful. Risk factor in the sense have high blood pressure, high cholesterol, or diabetes, or you're a smoker. You have to be careful with your diet, because the mortality or the deaths are higher when you have it below the age of 50. That's the reason you're hearing the sudden deaths and all that stuff.
Right.
So I personally would say anybody who has a risk factor between the age of 40 and 50, I would ask you to see your cardiologist at least twice twice in that entire group. At least you have to get screened. Because you might be thinking there are no symptoms. I'm doing that. I'm doing this.
Right.
And you're like, I work. My patients say, I walk every day at work, but it's not high intensity. It's not moderate intensity. You just walk. That doesn't count to exercise. They're like, I've been walking every day at my work. I don't know why I had a heart attack. No, you're not been doing high intensity exercises. If you're doing high intensity exercises, maybe we could have picked your heart attack. Before you had a heart attack, we could have picked it up. Because when you do exercise, if you have a blockage, you will know it, right?
So basically, when you're suggesting high intensity is
moderate intensity or high intensity.
Because if they do it, they won't be able to do it if they have a heart problem. Is that why you're suggesting? Or they should continue to do it to not have a heart problem?
Both of them. One is prevention. Other one, if you're doing moderate intensity activities, I will be able to pick up, you're going to have symptoms like chest pains or shortness of breath. Hey, I was able to do to walk 20 minutes before. Why am I able to walk only 10 minutes now? I was able to walk 40 minutes before. Why am I able to walk only 20 minutes now? I had a relative of mine who used to go to his farm every day in India and then come back. And then once he called me and he said, Amma, I'm getting short of breath when I walk 20 minutes. Okay, I said, you need to go and check. And he got it checked and he has multivessel disease. He ended up getting a bypass.
Oh.
He's an active person, relatively very skinny, but he does have risk factors. But yes, so he was able to pick it up because he was going, otherwise it would have not been picked up.
Oh, you're scaring me now.
No, I'm sorry.
I'm getting scared.
No.
I'm skinny.
No.
I walk. I do everything, but I also sometimes feel that.
No,
Right? So,
no. You're fine. You'll be good for 100 years.
Oh, thank you, doctor. Thank you very much. So here is another interesting question, doctor. So the young kids who have, who are 30, and you know how the marriages are happening today these days, right?
Yes.
People do get married late.
Yes.
30, 35s, suddenly they have a heart disease. How would their life changes? Like, you're young married, you want to have kids and all that stuff, right? How would that change, doctor?
In what way, sir?
Will that impact their sex life?
No, that doesn't impact your sex life. Absolutely not.
Okay.
It wouldn't, unless you have blockages. So when you have a blockage in the heart vessels, you can have blockage anywhere from head to toe.
Okay.
Okay. So sometimes the blood vessels supplying, the external genitalia can be blocked with a blockage. So you just have to get, if you're having problems, then you just have to get a screening done, make sure the ultrasound of the legs and, pelvis look good, that there are no blockages. Otherwise, it shouldn't affect. Absolutely not.
So if they have a stunt, for example, people do get, right?
Oh, yeah, absolutely.
30, 35, they are getting
they get
it, right?
stents, yes.
So they get a stunt. So what about at that point of time? They're still young, they just got married, they still have to have sex for kids.
I mean, we especially if they had a heart attack, we try to tell them to avoid for a month. But otherwise, they should be able to do anything they were doing in their life.
Okay, so that should not actually.
No, absolutely not really. And once you opened a stent, people get scared. Oh, I have a stent. You don't have to worry about it. Whatever blockage you had that has been already opened. What you have to do is prevent further blockages to happen. So you have to change your lifestyle. So whatever lifestyle you're doing right now, it's not good enough for your body. Every person is different. One person's lifestyle, they say like, oh, that guy was a heavy smoker and, he doesn't exercise like the way I did and he eats food, whatever he wants to, but he didn't get a heart attack, but I got one, when I'm so healthy. As I said, there is a genetic predisposition and we cannot tell who has it and who doesn't have it at this point. So one thing what applies to one person might not apply to everybody.
Okay, so it's totally different.
And that's the reason you cannot just Google and say, hey, okay, I Googled it. Okay, these are not my symptoms. These are my symptoms. I don't have to see a doctor. No.
Oh, yeah. So
there is a reason why we trained for 15 years in medicine. Okay, so don't confuse Google with medical degree, please. That's one thing I would like to tell.
Sure, that's definitely a good point you raised.
Yes.
I do see I hear that also, a lot of kids, young, patients, they think that they are doing a pre-work, their homework before coming to the doctor. And
yes.
I do hear that quite a bit of stories.
Especially in North Dallas, yes, I do quite a bit.
Okay, so how do you react to those?
I listen to it. I'm not going to say like that is wrong or this is wrong, but I tell them what is important for them and what is not important for them. Okay.
Stop looking at Google.
I wouldn't say that. I wouldn't say that. I wouldn't say that.
Good.
No, I just tell them because it's different for every person. So I would just tell them, this is what you have to do. This is for you. It's going to be different for every person. So, you can still continue to do that. Even if I tell them not to do it, they will still continue to do it. That's fine.
So would that not lead them to confusions and more stress and all that stuff?
It will. But are they going to stop? No. But looking at it also, they're going to get more information. And they also see everything like social media. It has both positive and negative parts of it. They'll be more aware of their symptoms when they read more about it and all that stuff. But I don't want them to come to a conclusion saying this is what I have or that's what I have. And go to the doctor properly. Go for your annual physical exams every year. And when you have a problem, discuss that with the doctor. Go and see the specialist when needed. They will be able to guide you in a proper way than Google. It has its pros and cons. Yes, it will lead to anxiety, but at the same time, it will also give you awareness of some problems, So I wouldn't say never for anything.
Okay. So earlier in your conversation, you were saying maybe in 100 years we will get to
manipulate genes.
Manipulate genes, right? So from the time you started your career to now, now that you also see AI, ML coming in play, how did that made any difference? Did that made any difference to your current job?
It did not.
Okay.
At this point, it did not, because AI didn't flourish yet. It's going to in future.
Okay.
Again, there are going to be a lot of pros and cons for everything. I think AI is going to be beneficial in certain areas for us. Like for example, there is this new which we just did a demo yesterday, me and my husband, on this AI modality wherein you go and talk to the patient in the clinic, like the way you're talking, about their health and all that stuff, and you turn that button on, and then it records our conversation, and it transforms into your office note completely, including assessment and plan, everything the way you discussed it. So all you have to do is just go and edit. So things like that, definitely they're going to be helpful. Is AI completely going to replace the doctors? That's never going to happen.
Yeah, because there is a talk, like, radiologists and all those kind of stuff might be replaced with
No,
AI.
absolutely
That's
not.
never going to
That's
happen.
never going to happen because...
because you're a doctor?
No, not like that, sir. As I said, every patient is different. So every CT scan, every MRI is going to be different. You have to link that with the symptoms, what they're presenting, and then you have to come up with a conclusion, So you cannot just randomly say, oh, this is how it's going to be, this is how it has to be. No, that's not medicine. Every patient is different.
So was there any typical case while you were treating, which you thought I should have done it in a different way than this way, which would have resulted in better results?
Yeah, there will be always cases like that, sir, because we're always learning. Everybody is learning. There was a case in New Mexico, actually. That patient retired. He was living on a lake, and then he comes to me because he had chest pain. But he never said it's chest pain. It's like I was mowing my lawn, and I just had this is how he presented. I had a heavy lunch, and then I was mowing my lawn, and then I got some indigestion problem. Then I drank soda, Coke. The symptoms resolved. Okay, all right. So I sat with him for 45 minutes, and I was like trying to retrieve what went, what is going on.
45 minutes.
45 minutes.
Do you guys spend that much time with patients?
We do. Yes.
Seriously?
We do.
I have never seen any doctor spending more than 5 minutes with me.
In our clinic in Frisco, that's exactly what I told you. So people actually, they were like, oh, you're starting your own office. It's been 2 months. We started our office in Frisco, and they were like, oh, especially to my husband, they're like, oh, you're starting your own office. Oh, that doctor sees 40 patients. You have to see 40 patients a day, and you'll make a lot of money. My husband said, it's not about money. We are not looking for money in medicine. And then he said, I'm going to see only 20 patients a day to my content. And he takes 1 hour for every patient. And he has excellent reviews just because of that reason.
So are you taking new patients, please?
Yes, we are taking new patients, yes.
Okay, let our viewers know that you're taking new patients.
Yes, we are absolutely.
We definitely want patients to come to you. We need doctors like you.
Yes,
right, in this
we are absolutely taking new patients. Our motto is service.
Okay.
So irrespective of caste, creed, or religion, our motto is to serve. Because we took an oath in our medical school that whatever my teachers taught me, as my teacher was my dad, of course, taught me, we are going to use that in the society. We're going to treat our patients, So that's
you're talking about the oath every doctor takes, right?
Every doctor takes, yes, of course.
So some doctors forget about the oath, and some
that's controversial. I don't want to talk about it. But this is our motto. It's service. So when people were like, when that girl's mom was thanking me and everyone was thanking me, I felt like, okay, but this is what I'm supposed to do, right? I don't have to be thanked for this because this is what I'm here for. And then my sister taught me gave me a very beautiful example. My sister had cancer for 6 years, and she was undergoing chemotherapy every month, but she worked 15 days. That's her full-time job, 15 days in a month. And she always told me that kept the drive. And she treated patients in her sickness. She took care of the sick in her sickness, and she never complained a single day, Andy. So when I wake up in the morning, if I'm feeling one day tired or like, oh, I don't want to go, I just remember her and I'm like, okay, what is there to complain? Why am I complaining? I should just go take care of the patients. So that's actually my drive every day.
That's a beautiful example.
Oh yeah,
that the current generation or the youngsters or anybody for that matter, the kind of motivation they should carry. If a sick doctor can treat a sick patient without complaining,
yes,
that's like I don't have words to
Exactly.
explain that.
So that's exactly what I think every day. Actually,
And I am getting emotional. I'm telling you honestly, you know,
I mean, she's an amazing human being. You know, she's an amazing. She was an athletic champion, gold medalist. You name it. She was a topper in everything. It's very sad that you know, our world lost a soul like her. But in everybody's life she touched, she made a difference. Her friends actually messaged me saying that even though she was in our life only for a short period of time, you know, she changed this and this. You know, she changed my life altogether.
You have another one, like
my daughter, yeah.
daughter, yeah. So she's gonna give back to the society again.
Yes.
Yeah, good. So thank you, doctor. Lastly, one last question, very
Yes.
personal question.
Yes,
I'll ask
yes.
you and your husband. Is it arranged marriage, love marriage? What is it?
I would say both.
Oh, okay.
But we met on a online dating app.
Oh, okay.
We had a lot of common friends, but we never met through them.
Okay.
But we met through that, and then after a couple of months, we knew that I think we want to live together for the rest of our lives. So we told our parents, and with their mutual agreement, we got married here in Dallas.
Oh, wonderful.
Yeah. So in
Okay, I
2018.
missed that. When did you get married?
In 2018.
Recently.
Yeah, 6
Like
years ago.
6 years ago.
Yeah.
Oh, okay. That's when you bought that land, is what you said.
Yes, one of the lands.
One of the lands. Oh, okay. Wonderful. Excellent.
Yes.
Excellent. So if somebody has to reach out to you on the real estate part, do
Yes.
they reach out to you, or you have a closed group, only you work with them?
I know if somebody is interested, yeah, they can definitely reach out to us.
Okay.
Yes, we have a closed group, but didn't open it out to everyone yet. You know, but maybe in future I will. But at this point, it's like friends and friends who know your friends. You know,
Okay.
it's like
Okay.
that. That's how we've
Friends
been.
and family.
Friends and family predominantly at this point.
Oh, okay.
Because we have to work with them. But so far, like I have like 8 LLCs under me. So far, you won't believe it. Not even a single problem with anybody.
Knock on wood.
Yeah, knock on
That's
wood.
good,
Yeah,
that's
I mean, we do have some hiccups here and there.
Yeah.
But me and my husband work it out, and then we come up with a solution.
So all these people under your 8 LLCs,
Yes.
So how do you, like, you know, everybody has their own mindset, right?
Yes, absolutely.
So how do you manage them? Do you just tell them that, hey, shut up, I'm doing it, just listen to
No,
it,
no, no.
because this is going to take you there, here, and stuff
No,
like
no,
that?
absolutely not. See, sir, some real estate can just double. Some real estate might not grow. Some real estate can become 10 times. It's difficult to say which one. Our job is to pick the right one at that point.
At that point.
At that point,
you think
yes.
that is the right one.
Yes, if it's if you think it's the right one for you, because we
Correct,
present
correct.
everything to you, you're going to stay.
Right.
If not, you wouldn't. But most of them, they either trust my husband, they know us for a long time, or they know me for a long time.
Okay.
So our initial LLC were all my husband's friends, and some of them didn't even look at the property. You will be surprised. And they just went by the gut feeling of what my husband said, you know.
Very good. Well, thank you very much, doctor. Thanks a lot for spending this beautiful morning, Saturday morning, in my show, Point to Point with Shiv Vadlamudi. I'm honored to have a cardiologist in my show.
Thank you.
And I'm hoping to see many more docs in my show for
Sure,
our
sir.
viewers, so that they get advices from you guys, how to, you know, take care of their health, and when to reach out to doctor, not to totally depend on Google. Don't make conclusions out of Google and
Yes.
stuff, because that is available, right? And
Yes.
people do that. So thank you very much, doctor.
All right. Thank
Thanks a
you.
lot.
Thank you so much for having me, sir.
Our pleasure.
Thank you
our
for taking
pleasure.
time.
Thank you.
Thank you.